I decided to go to medical school after an experience being a EMT on an ambulance followed by a paramedic. And through that experience really showed me that I had a passion for taking care of patients. And because of that exposure, I decided that I would go to medical school. I went to medical school at Uniformed Services University in Bethesda, Maryland, and was active duty Navy for the full 4 years of medical school. But as I went through medical school and got exposed to all the different specialties and subspecialties in medicine, I found myself drawn to taking care of cancer patients. And I was fortunate enough to do an otolaryngology, or an ear, nose, and throat rotation, and had experience to head and neck cancer patients. And it was the combination of seeing patients in clinic with both medical and surgical problems, as well as the team approach to taking care of head and neck cancer patients, that really drew me to that field. After medical school, I did my internship at Portsmouth Naval Hospital in Portsmouth, Virginia. And then, as most medical officers in the Navy, after internship, you're placed in a general medical officer position. And I was stationed on the USS Emory S. Land and was the sole medical officer on that ship of 1,100 people. And after a rewarding career in the Navy and other academic institutions, now I am the medical director of the Milton J. Head and Neck Center. Here at the Milton J. Center, we see patients who have been diagnosed with head and neck cancer or have a suspicion of having head and neck cancer, such as patients with neck mass or painful swallowing, weight loss, any symptoms that are suspicious for head and neck cancer. My practice is very general in terms of head and neck surgery. I've always seen a wide variety of head and neck cancer patients, including patients with skin cancers, oral cavity, throat cancers, thyroid cancers, and sinus tumors. So head and neck cancer is a very diverse field because it involves tumors of multiple different sites and locations. Head and neck cancer treatment is multidisciplinary treatment by definition. That means we really have a team approach. It really does take a village to take care of a head and neck cancer patient. Head and neck cancer surgery at GBMC is very different from many local programs and programs nationwide because we do have this embedded team of rehabilitation specialists. Speech and swallowing therapists, the social workers, dietitians are all here in our office and see patients, are very involved with their care from day one. Even before they get treatment, the patients will meet with what we call the dance team, who is really a rehabilitation team, to help explain their treatment and any side effects from their treatment, whether it be surgery, radiation, chemotherapy. It makes it easier for the patients really on two fronts. One is that all their doctors are typically in the same building. Medical oncology, radiation oncology, and head and neck surgery, all being in the same building means they can have one-stop shopping, so to speak. And then having the speech and swallowing therapists, as well as the social workers, dietitians, and head and neck nurse here on our team, seeing patients on a very regular basis. And it really helps patients understand what their treatment is going to be before they embark on their treatment journey. And it helps them get through their treatment because they have that side-by-side support as they're going through their radiation and chemotherapy and or surgery if they need that. And it helps them work through side effects of treatment or cancer after they complete their treatment. You know, they really have a team of people that's helping to take care of them through their whole cancer journey, which really starts from the time of diagnosis and ends, 5-10 years after treatment, because head and neck cancer has a profound effect on patients' not only appearance, but their socialization, because it impacts their speech and swallowing, as well as just their self-image. So we really try to have a holistic approach to get patients through their cancer journey. I love my job because I love seeing patients, and I love the diagnostic challenge of head and neck cancer, and I like working with the great team that we have here.